Hello. Today's presentation, Reduce Risk, Enhance Results for Skin of Color, will explore the nuances of ethnic skin as it relates to their market share. We'll also show a skin scale that determines the propensity for hyperpigmentation, scarring, and much, much more. Welcome. I'm Pamela Springer. I want to personally thank you for the opportunity to present this presentation. As a global skin expert, my background includes 20 plus years as an advanced aesthetics educator. Providing continuing nursing education, healthcare professionals learn how to lower risk factors when performing advanced treatment modalities. I formulated a corrective skincare line called Global Skin Solutions to meet the needs of the ethnic market. Participants will be able to learn three important considerations. These considerations start with a visual inspection of your patient's skin assessment as it pertains to the hue of that skin. You'll be able to compare and contrast methods of that skin assessment by using evidence-based scales. Most importantly, the most popular aesthetic interventions, both medically supervised, will be reviewed. This will include the cautions and concerns related to pigmented skins when providers perform minimally invasive skin rejuvenation procedures. The new face of beauty is the global market. It is rapidly changing, and you should become involved. The American Society for Aesthetic Plastic Surgery, their 2017 report stated that Americans spent 15 billions, that's billions with a B, on aesthetic procedures. 22% of those surgical and non-surgical procedures were done on ethnic patients. 60% of those procedures were performed in office facilities. These trends are likely to continue, especially with increasing numbers of ethnic patients seeking medical spa services and procedures. Did you know that African American spending power has reached over $1 trillion with a T dollars? This ethnic group spends 5 to 6 times more in beauty products than the general public. Your Hispanic group, they believe in good skin. They believe it's the foundation of true beauty and will pay higher price points for skincare products. Your Asians are known to have a strong brand loyalty. If satisfied with cosmetic services or products, they will spread the word to family, friends, and within their community. The new faces of beauty is non-European. The non-European population, they're basically looking for beauty services and products that understand their needs. Companies like Avon, L'Oreal, and Procter & Gamble are spending millions of dollars on research and development to create products for this market. I say the world is becoming a more colorful place. In the United States, you can see the changing complexions of your patients. And you need to ask if some of your patients are racially blended. If so, are you using the correct scale? Do you rely on that Fitzpatrick skin scale? Well, this scale only determines the response to UV light and the skin's ability to tan. It does not predict the skin's response to trauma, and it says that skin types 5 and 6 do not burn, but skin types 5 and 6 are susceptible to burning from the UV rays. For blended skin, it is important to use a scale of skin classification. And the scale that I like to use is your Lancet Ethnicity Scale, which was developed in 1998. It looks at your ancestral background and combines it with the Fitzpatrick Scale. It helps determine your patient's risk factor for hyperpigmentation, for scarring, for difficulty in healing. It helps to know if that skin can tolerate certain chemical solutions. By keeping in mind that no chemical peel, laser, or surgery will always give you the absolute outcome that you're looking for. So know that none of those procedures are risk-free. Now here is the actual Lancet Ethnicity Scale. It's going to tell you ancestral background, it's going to give you the skin type, and it's going to give you that risk factor. So how does it work? To determine a risk factor, let's say for a laser procedure, you have to calculate the skin types of the maternal and paternal parents. In other words, the patient's grandparents. So let's say on the maternal parent side, the maternal grandparents, the grandmother was a skin type 1. Let's say she's from Ireland. But the grandfather was a skin type 5. He may have been African American. You'll add those two up and you'll get the number 1 and plus 5 equals 6. Let's talk about the paternal grandparents. The grandmother is a 2. Let's say she's from Central Europe. And the paternal grandfather is a 4. He has Spanish blood. 2 plus 4 is 6. So when you add both 6s, 6 plus 6 equals 12. There were 4 individuals that you determined their ancestral background. So 4 into 12 equals 3. So now you look at the scale and see that your patient has moderate risk for hyperpigmentation, scarring, or any other of the risk factors that are presented in pigmented skin. Now the key points to lowering a risk factor is, we all know, give enough time to actually have an intake form that is going to have all the questions necessary for you to determine what modality or treatment that you want to perform. So you should include a lifestyle, because if somebody works out in the sun a lot, we're going to know that they need to be wearing their sunscreen. There's certain medical conditions that might be prevalent in certain ethnic groups. It's great to understand how much dairy products one may consume, because in the Hispanic population, they do consume a lot of cheese and dairy products, and this tends to aggravate acne. So in some cases, if that acne you're not seeing or getting any kind of control over it, it may be because of the mucus that cheese is producing within the body that is causing the acne. Think about the sunscreen compliance. It is well known that Hispanics, and especially African Americans, they do not believe in the use of the sunscreen. We were taught that we didn't need sunscreen, so it's very important for you to do patient education for these particular patients. What about prescriptions and over-the-counter medications? A lot of the ethnic groups have certain cultural habits, but more importantly, when we're talking about prescriptions and over-the-counter medications, the botanical or herbal remedies that they may be using that may be a contraindication to whatever that prescription you want to prescribe. So understanding what they're doing at home is very important. What herbs they're using and how it's going to affect a prescription that you may prescribe. We already know about the ancestral background, but then it's important to identify the patient's goals. If a patient comes in with brown patches and we know it's melasma, that patient inevitably is there because they want the removal of those brown patches. Before actually telling them that they could be removed, understand the depth. If you don't understand the depth of that patch, you're not going to realize or be able to tell that patient that you might be able to lighten the actual patch, but you won't be able to resolve it. Because if you go into the dermis, when you educate them, if you're going deeper into the skin, it might cause hypopigmentation, which that definitely is something that your patient does not want to experience. So first, identify their goals so that they are not surprised at the outcome and it's not in the favor that they feel it should be. On that note, we need to understand the tools of the trade. And I'm going to use melasma again. It's important to determine the primary and secondary cause. Is it caused primarily because of the sun stimulating and causing sun damage instead of melasma? Is it because the brown patches are due to the overproduction of melanin caused by hormones, pregnancy, hormonal replacement therapy? Is it possible it was caused by birth control pills? Was it caused by medication or a medical condition such as hypothyroidism? It's important to have the correct equipment that you can use to examine the skin, especially below the surface of the skin. So I do show a woods lamp. That black light is phenomenal when you have the room totally dark. You can begin to see those patches and the depth of those patches. But having an imaging system, some cameras will allow the picture to be seen after being in front of an imaging system, and now the client can actually see the patches that are below the surface. Now, I like personally the skin scope. Some people call them a skin scanner. It's an interactive tool. And in this case, this client was blended, their skin was blended with European skin type and a Native American. So you do see the pigmentation just below the surface, but she sees it as well. Now, the next step was to actually take that picture, which I use a camera at the viewer and just snap the picture. If you notice that white area under her eyebrows and across the bridge of the nose, it is from her transitional glasses that was resting on the face when she would go out in the sun. So it shows how those glasses were protecting those areas from any kind of pigmented lesions. Let's talk a little bit about the skin histology. When we look at the epidermis of a skin type or tone 3 to 6, you're going to find that there's more cells that are compact in that stratum corneum. That epidermal layer, that stratum corneum, is going to be not thicker in the sense of showing measuring thicker, it's going to be thicker only because the layers are more compact and there's more layers, cell layers, contained within that stratum corneum, that dead layer of skin. Lower ceramides are found in African American skin, but Asians tend to have a higher ceramide level in their skin. So African American skin is going to be more prone to transepidermal water loss than, let's say, an Asian skin. Also, depending on the Asian and where they're from, if they're Japanese or Chinese, they're not going to have as much melanin content as an African American or a darker Asian, like, let's say, a Cambodian skin type. And a Cambodian or Asian skin type that is of a darker hue is going to produce a larger amount of melanosomes, which is the pigment cells that are concentrated within the skin. And those cells are produced from the melanocytes. And we all have the same amount of melanocytes. When we look at the dermis of a darker skin tone is going to have an increase in collagen production. And this is why a darker skin tends to keloid, because those bundles of collagen fibers bundle up and cause an overgrowth or scarring, and we call it hypertrophic scarring. In a darker skin type, when you compare it to a European skin type, there's less elastin fibers, so there's less snapback. But remember, the collagen is like a bridge, so it's holding up that epidermis. So you're not going to get the sagging or the wrinkles and all those skin challenges on a Fitzpatrick 1 or 2. The nerve endings on darker skins, they tend to be closer to the epidermis, so it's going to give a skin more of a sensitivity when you apply chemical peels or lasers on that skin. Darker skins are going to tend to have a larger amount of sweat glands, and it's because of the original ancestral origin would be closer to the equator, which you're going to have the tropical climate, and there's more perspiring. So those skin types that are closer to the equator, they're going to have more sweat glands, especially in the face, the axilla area. You're going to see in the chest, you're going to see more larger sweat glands. You'll find a numerous amount of dilated blood vessels when you compare them to a European skin type. So now let's look at the skin. So on the left is a thin skin, and on the right is a thicker skin. And on the right, it's only thicker because of the collagen. There's more collagenous material within the dermis, so it's going to give you a thicker looking skin. Now here's another point that you should understand. When you advertise or you want to market to a certain ethnic group, you want to make sure you have their image included. But also you have to be careful of the colors that you're using in that message, because the colors could cause a message that is negative to that ethnic group. For instance, red, which can be very tricky. It is a very happy color for a Chinese or a Japanese or even your Vietnamese. But for a South Korean, it is going to remind them of communism. So that's going to be a turnoff. And when we talk about Asian skin, make sure that who you're trying to capture, you use that image, like I mentioned before, of that Asian, because you're going to have South Asians, which is going to be a darker skin, your patients from India, versus an Asian of a lighter skin that you're going to find as Chinese or Japanese. Now, when we talk about laser hair removal, we need to avoid risk factors, definitely. So in this photo, you're going to see results of someone that wasn't trained on the laser setting for a darker skin. So I always recommend for providers to pursue an advanced course in ethnic skin. And the treatment modalities is great if there's a lot of hands-on. So in the left photo, you'll see that he was burned considerably, and now he has hypopigmentation, where on the right he was just left for scarring. Both of them was the procedure that they wanted is removal of the ingrown hairs caused by the use of a razor, and usually using it incorrectly. On this photo, this was caused by a 30% glycolic. Now you said it was only a 30%. Remember, 30% is the concentration of the glycolic, which isn't a high concentration, but the pH was below a 2. And because the skin wasn't primed properly, the skin was stimulated by the application and the glycolic driving itself quickly into the stratum corneum, into the dermis. Now, the melanocytes that produce the pigment is in the stratum basal layer. So it's stimulated and caused that irritation, that area that was mostly irritated, those pigment cells to come to the surface of the skin, and you end up with post-inflammatory hyperpigmentation. I always tell anybody that's in my course that when you look at a Caucasian skin and you give a chemical peel and that skin turns bright red, well, you better be very cautious, because that red turns to brown on a darker skin individual. So again, always check the pH level. Now, you will be able to use a lower pH, but that skin has to be prepped or primed prior to the application of that chemical peel. I have some before and after pictures to show you some of the clients that I worked on using an AHA, BHA, TCA. I also layer AHAs with BHAs and a vitamin A peel, and sometimes I do dermaplaning or microdermabrasion. It just depends on the need, and combine it with a chemical peel. So this was one layer of Jessner. This was after the skin was prepped for about 5 or 6 weeks with skin lighteners, and I use products like a home care glycolic product because it's a smaller molecule, to drive that skin lightening deeper into the layers of the skin. So that was only one layer, so you can see the beautiful results. It got rid of the damaged skin, but also lightened a lot of that pigmented area. This was used with a combination peel. It was layered with a salicylic and a few layers of modified Jessner and a few layers of Jessner. And of course, this was sun-damaged skin, and you can see the results. Now, the only thing about these pigmented lesions, if they don't comply with their sunscreen, the skin has memory, and all of a sudden all of this can reappear on the skin. This client, it took 16 weeks, and I did a lot before, but some of it was the modified Jessner, some of it was the Jessner, and the vitamin peel. I like to do a lot of layering, and what I don't have on this slide is the last one was a Jessner and a TCA, and that TCA is only 20%. Now I may have used the 10%. I don't remember exactly, but it probably was the 10% because she is of a darker skin tone. In this is a Hispanic client, and we just had a problem with all this redness and irritation. So we did an ice application. She did it morning and night. All she did was take a styrofoam cup, fill it with water, put it in the freezer, take it out when it was time for her regimen. After her morning regimen, she actually held on to the styrofoam cup and iced her skin, and for about 2 or 3 minutes, put it back in the freezer, and that night did the same thing. Now remember, bacteria can't grow on ice, so it's no sense, you don't have to sanitize the ice at all. Now this was a very easy treatment, because this person, she really was breaking out because of the ingredients in her blush. So this took about 6 weeks, and I just combined the enzyme. The products I have has bromelain enzyme mixed with a 25% lactic acid. So this helped to not only hydrate her skin, because she was at the time very oily, but also to exfoliate and rejuvenate that skin while the skin reversed itself from those breakouts. This is a person that had acne. I did not control the acne. She went to a dermatologist, but he was afraid to do any chemical peels on her skin, and so I just did a microdermabrasion and calmed the skin down, and with a cool towel, and then I put on about 4 or 5 layers of a modified Jessner. This is my pride and joy, because this young girl was in agony and had tried to commit suicide 3 times because of her acne. And we got this all cleared up in about 8 weeks, is how long it took me to take the skin from the picture on the left to the skin on the picture on the right. And I used a lot of salicylic to calm that skin, but I also did some layering with vitamin A and TCA. So this was, I say, my pride and joy, because I was able to let her see her skin and where it can be without, what it looks like without the redness and those lesions. This took 12 weeks. She was a teenager, and the skin was very thick with oil, and of course her breakouts. And we did microdermabrasion, Jessners, and a TCA, because that skin was so thick. The first, on the 3rd or 4th week, I did just a Jessner just to rid itself of the oil, because none of the products were penetrating into the skin because of the buildup of oil. Well, thank you so very, very much. This is a list of my CE providers, my provider licensing. And I really thank you so much for the time you spent with me. For any information, there's my email address. But would you go to my website if you have any questions? I have a contact form that you'll see the minute you get on there. It's in orange, says contact form. If you want more information, could you be very specific, especially if it's for trainings for your office? And also, if you'd like to just have a conference call for 30 minutes, it's complimentary. Or you can call me at 855-290-5444. 54. That should be 50. Okay, 85. Oh, it is 855-290-5450. Thank you so very much. It was a pleasure, and I wish you the best for the rest of this conference. Be safe.